Today, we are going to be discussing exercise progression and how to manage flare-ups. For the back to move well, we need the muscles, ligaments, joints and nervous system throughout the spine to be in balance with each other. This means that having poor muscle control can inhibit your recovery or make it more difficult to return to your hobbies and work. There are many benefits to exercising regularly, including improved flexibility, endurance and fitness, which all help in the prevention and treatment of back pain, as well as other conditions such as cardiovascular disease. Feel-good hormones such as endorphins are released when we exercise, and these have been shown to be effective at reducing pain symptoms. One of the aims of this course is for you to engage in a regular exercise program that will improve the control of your back whilst you move. This will help you towards achieving your goals and returning to your normal daily activities. Any exercise that you choose to do must be enjoyable, or you are unlikely to continue it long term. There will always be barriers like time, childcare, illnesses, travel, cost, etc. And the only way to overcome these is to make this exercise or active hobby a priority rather than a chore. Maybe find someone that you can do it with or set a goal for yourself, both of which will improve your motivation to keep exercising regularly. The next thing that we are going to discuss is how to manage flare-ups. There are a few things that we suggest for this, and the first is don't panic when a flare-up happens. This is easier said than done though, but stress and anxiety have been shown to increase pain. Remember, serious damage is very rare, and often pain may flare up and then settle down again quickly. Think about what you may have done to cause it. Maybe you've been for a longer walk than usual, or you've painted the spare bedroom. When it comes to trying to manage your symptoms, there are several things that you might find helpful. These include heat, simple painkillers or anti-inflammatories, although these should be used as little as possible for as short a time as possible. You could also try gentle stretches, relaxation or breathing techniques and self-massage. The next thing we advise is trying to take it easy for a little while, and although total bed rest is not helpful, there is no harm in taking some relative rest, particularly from activities that consistently aggravate your symptoms, for a day or two. Once your pain settles, you might find that you can begin to build your exercise up again with some gentle stretches or a short walk that you can then build on as you feel better. When it comes to medications, non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen can be used. Both are anti-inflammatories and are usually taken as a short course to manage acute pain or flare-ups. Ibuprofen is available over the counter, but naproxen, which is stronger, is only available on prescription from the doctor. Paracetamol can be effective for treating acute flare-ups for the first few weeks of low back pain, but becomes less effective with chronic pain. If your symptoms are more severe, your doctor may prescribe a mild opiate-based painkiller, such as codeine. With severe acute pain, your GP may prescribe a muscle relaxant, such as diazepam, alongside painkillers and anti-inflammatories, but again this should only be used for short periods. Amitriptyline is also used as an antidepressant, but it can be effective on persistent nerve pain that has not improved within the first few weeks. It can also be effective if your pain is limiting your sleep significantly. Gabapentin and pregabalin are an alternative form of painkillers, also used for the treatment of persistent nerve pain that has again not improved in the first few weeks.